everyone. My name is Bethany Smith, and the topic tonight I want to talk about is ethical issues in the ABA setting, and also give an example towards the end of the presentation on how to handle a certain situation. As analysts, what we as analysts we're constantly faced with ethical problems, and it is up to us to honestly know how to address those issues in an ethical way. The first thing I want to talk about is evidence-based data. All clients deserve evidence-based treatment because it is the most effective treatment. There are honestly a lot of fads going on, but it is up to us as analysts to inform the client why we choose evidence-based data and explain why it is better as opposed to going with the temporary fixes, typically these breakthrough methods that these fads typically do. As analysts, we tend to run into diets, shock treatment projects, sensory gadgets, etc., especially in the medicine ABA field, and it is our jobs to show our clients the reason why we choose a certain treatment plan over any of those. Another thing I want to talk about is working with others. As analysts, we may face situations where we work with other professionals in other fields that try to undermine our data and vice versa. It is always important to take everyone's thoughts and opinions into consideration and to work as a team. However, it is important to make sure we use evidence-based decision-making skills and education and educate other members of the team on why we do evidence-based data and why it is also the most effective. Another issue I want to talk about is data taken / data faking. We also tend to run into employees, co-workers, bosses, etc. that may slack off. In our field, it is important that everyone collects the It is important that the data everyone collects are consistent and accurate because it's the best method to come up with the most effective treatment. When we have the right data, we come up with the right solution as opposed to just guessing. Another issue I want to talk about is dual relationships / favors. It is important to know when to decline and when to say yes. As an analyst, we may run into bosses and coworkers or even clients sometimes who may cross the line when it comes to keeping a professional relationship. It is up to us to highlight those boundaries and abide by the ethical code. Confidentiality is one of the most important ethical codes. Why it's the most important, it is one of the most important. It is our job as analysts to make sure that we safeguard our client's information and identity, especially when someone who isn't the client or the guardian of the client asks about a specific client. The example I want to bring about is, let's say if you were out shopping one day and a client's parent's friend comes to you and asks you about, what's going on at the clinic, how's the client doing, what goals does the client have, etc. It's up to us to let the person know we are not allowed to share that information with. According to Ethical Code 2.06, that's with to protect our client's confidentiality. If the person wants to go and ask the parent of the client, that's perfectly fine, but we cannot provide that information. Ethical codes are honestly just there to help us and protect us in the ABA field, and it makes the great tool to apply in our everyday practice.